Hi, my name is Jennifer Penrose from Penrose Physical Therapy, and I wanted to talk about knee arthritis, how to stop that from controlling you. I think a lot of times people realize that their knees are changing and they start out with just kind of clicking, crunching, cracking noises, and that's kind of when you should start to pay attention to those knees before it becomes painful. Start looking at when you are getting up from a seated position to standing, kind of the alignment of your foot. If your foot is not well supported, you won't maintain that arch when you are in standing and walking, and when your arch collapses, it can pull on that knee to have it kind of dive inwards. And so kind of starts with your foot structure and the foot support you wear that can impact your knee greatly. And also look at when you go from a standing position to a seated position. Do your knees kind of dive in? Do they stay more bow-legged? You want to keep the knees in line with your second toe and keep it straight so the forces at the knee are not too great. So just some tips there to look at, and footwear really does have a big role in protecting our knees. So when I see those slippers and Tom's footwear, I almost cringe, because as you walk around, those have no support, which then stretches out the ligaments and joints in your feet. And when your feet flatten out, then there's less support up the chain to the knee, and kind of causes that knee to dive inward. So it has a role in absorbing shock up the chain, up to the knee, and even the back. So some of my patients who end up getting orthotics for a foot or a knee issue, they actually are surprised that, guess what? Now my back is doing even better. So the footwear really has an impact on our function, and particularly the knee. So at least start there. But those are some practical tips that you can use to help with early signs of the knees changing. But even later on, if you're really having active knee pain, wearing the right footwear can really make an impact on reducing your knee pain. So just wanted to throw out some practical tips for you to think about, and happy to answer any further questions about knee pain and the noises your knees make, and the progression of potential arthritis in your knee. So that's what we're here for. Thanks.